Hello, everyone. Greetings for the day. I'm Sayukta from All About Skin Wellbeing, and I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash that can be really itchy and equally annoying. Antifungal medicines treat fungal infections. Antifungal medicines can kill a fungus or they may stop it from multiplying or growing. There are several classes of antifungal medications and different types of medicines. So let's connect today with our skin expert, Dr. Renu Nair, live from Bangalore, Karnataka, to enlighten us on the topic of antifungals. Dr. Renu Nair is an expert dermatologist, aesthetic dermatologist, dermatosurgeon, hair transplant surgeon, and trichologist with rich experience of almost 15 years. She has in-depth knowledge of related area and have placed immense trust in her patients over the years. A very warm welcome to you, Dr. Renu Nair.
Thank you so much. Thank you for inviting me for this.
It's such a pleasure to have you, Dr. Renu, with us. And today you'll share your expert views on a very common or important topic, which is antifungals and definitely fungal infections. So let's start the session, Dr. Renu. To begin with, we would first like to understand who is at risk for fungal infections and basically what is fungal infection?
Right. So fungal infection, as you know, it's one of the most common skin infections that we see. Anybody can get it. It's not necessary that this age group or this particular patient can get it. So it's a very widespread disease, not just in India, all over the world. Some people, yes. So the common conditions that we can get is when there is a little bit issue in the hygiene, because you know that fungal infection we get when the skin has a little dampness or moisture is there. So the common areas like our inner skin folds, in between our toes, our feet, these are one of the common areas that you can get fungal infection, especially if we don't take care of the areas. So if hygiene is not proper, if we use a lot of public places, washrooms, public areas, so there, it may not be very clean, so we can easily catch the infection. So common areas, that is one place that we can easily get it. Then lack of hygiene. Then certain seasons like monsoon season, where generally the there is dampness, there is a increase in the fungus in our environment. So that's another time that you can catch it. And finally, in people whose immunity is a little on the lower side. So people who are diabetic, who are post any major transplant, or people who are on steroid medication. So such people are also at high risk of getting fungal infection.
Right. So this is all about fungal infection and who are at risk of fungal infections. Now, as you very rightly said, that monsoon is one season, right? And it's already the onset of monsoon. So we see a lot of dampness, plus our clothes are not completely dry. Most of the times the machine wash or dry is not that effective. And as you have already mentioned that it can, somebody can catch it from someone else, especially in a public area where we don't know that an infected person is already there. But then in a family, we have a controlled environment where we know that, okay, somebody is infected with fungus. So what are the precautions that we can, take care in a family?
Yes. So as we said, we transfer fungal infection from one person to another person, and also through contaminated surfaces and contaminated, clothes and all that. So in a family, it would be better if everybody keeps their own towels, their own soaps, everything separate. So we can even use, this liquid soaps so that nobody is touching it, and it's more clean that way. So if everybody wants to use the same thing, that is one thing that we can do. Otherwise, have everything separately for you. Do not share your personal items with another person, even if it's a family member, especially if there is fungal infection in the family. Then second thing is, yes, even in, sometimes hostels and all that, do not share your clothes. Sometimes we do that, but, it's better to avoid that, especially if we want to avoid fungal infection. And all the clothes in monsoons, especially, you can iron dry it so that, there is no dampness left. And make sure you clean your clothes properly. So even if we wear it for like half an hour outside, don't hang in the cupboards without washing it if you have a history of fungal infection. So these are some of the things that we can take care, to avoid. And another thing is, if anyone in the family has an infection, get it treated at the earliest. Don't sit with it. Don't use any random ointments for it. Please get it treated at the earliest so that you're not sharing it to the other family members.
Right. The whole purpose, the whole idea behind having this session is to spread awareness that how important it is to go and consult a right person, which is a qualified dermatologist in this case, in case you have fungal infection or say any infection. So please don't ignore it. And plus, because now we know that it is transferable, right? I can get it from somebody else, somebody can get it from me. So please be even more careful about it. Now, we just spoke about a family or hostel where situations are under control, where we at least know that, okay, this particular guy or girl is having this infection and we need to take care. Now, as you said, we normally catch it from a place which is in a public domain, gym, bus, trains, etc. Now, there we don't know if somebody is affected or not. But then we know that there are few seasons, or if I'm, more prone to fungal infections, that I have to be more careful. What are the things that we can do or we should avoid when we are in a public domain, specifically as one is prone to fungal infections?
Correct. So first thing, suppose if it's a gym or a swimming pool sort of thing, everything you take your own stuff. Do not share anything from the public area. Use proper sanitizers, before workout, after workout and all that. You can use sanitizers, which also have, some role in avoiding the fungus. Then for the feet fungus, what you can do is avoid walking barefoot in this public areas. Make sure you're wearing some slippers always and you're not walking barefoot, because through the feet, otherwise it's very easy to catch it. So avoid sharing stuff. And once you come back from them, make sure you have a proper bath, you change all the clothes, you wash them. Then walking with slippers, using sanitizers, all these we can do. So suppose you're using a common washroom, you can put some tissues there, you can use some sanitizers before, after, so that you are not having any contact with those contaminated environment. So these things help to some extent. And of course, if and as we said, everybody don't catch it, even if you're exposed to it. People who have some abrasions or cuts in the skin where the fungus goes in, if your immunity is not able to take care of it, then they catch it. So as soon as you see any rash, any suspicious rash, start taking the treatment early, because in the early stages, just a few days of cream will take care of it, rather than going on for months and months of therapy later on once it spreads.
Right. And as you mentioned before, that don't try on your own, don't use ointments over the counter, etc. But the very general tendency that we Indians have is, because chemist shop is so nearby, there are so many, the approach is so easy, plus it is easily available. So, and plus there are so many antifungal creams, ointments that are being advertised, over TV, over social media, etc. There are so many names that we know. But then why it is not advisable, by as a doctor you don't advise to use these creams, because normally if I get an infection, or if I'm sure that, okay, this is a fungal infection, I'll go buy some over the counter medication and start treating, and initially it works wonderfully, right? For whatever reason. So I would like you to shed more light on it, why it's so dangerous to use over the counter medication.
Yes. So as you said, the first cream that everybody gets from the chemist or from another family member or a friend is a cream which will be a combination cream. So it will contain all the ingredients. There is an antibiotic, there is an antifungal, a steroid, and something else. So it is like a mix of all those things. So when you use it, initially you feel a relief from your itching, you feel the rashes coming down, but as soon as you stop it, the fungus starts growing. So the main problem here is the steroid component of that cream. And we doctors, we face a major issue treating fungal infections because of the same self-medication, because people come after using all these steroid containing creams for a long time. So what happens is, as soon as they stop the cream, the fungus multiplies. It's just a temporary solution for your itching. It's not affecting the fungus at all. In fact, it helps the fungus to grow as well. So we get these infections which are more harder to treat, which take more longer time to get rid of it. And some of them come with steroid-induced side effects, like they get these stretch marks, they get this pigmentation issues after using it for months and months altogether. So using this by yourself, one, it is harming your skin, plus it's not getting rid of the fungal infection. And we also have to give more stronger medications for a longer term in such patients. So this has become an epidemic because of lack of awareness among patients, using random ointments, whereas when it is initially, when they come without self-medicating, it was much easier to treat. So now, because of all this medical, so we have even tried stopping this medications, which comes like a combination. Either you use an antifungal or you use a steroid for certain other conditions. This combination medicines is what creates a lot of problems here. So even if you feel it is a fungal infection and you are not able to meet the doctor initially, you can just get a plain antifungal cream. Always research whether there is a steroid component in the cream, and please do not use any creams with steroids without your doctor consultation.
Right. So that's why it is so important to consulting a qualified doctor in case you have infection. And as you also mentioned, doctor, many times we as laymen, we won't be able to differentiate between fungal infection or any other kind of infection or eczema, etc. We would like you to explain a bit more about how does it look, how to in a way diagnose by ourselves that this is a fungal infection.
Okay, so it's not always easy to diagnose, but I'll just give some first aid measures that you can do. So typically, the most common fungal infection that we see is the ringworm, or we call it as the dermatophyte or the tinea infection. So it's called ringworm for the same reason. It comes as round patches, round reddish patches. It can appear anywhere in your body, but the most common place will be in between your pubic areas, your private areas. Sometimes it comes on the underarms, buttock areas. So mostly the covered areas where our sweating or our moisture is a little more. These are the areas it comes. It can even come in between your toes and all that. Okay. So they'll be a little round in shape and they'll keep expanding out. They will have a lot of itching. There will be redness. Okay, so but unfortunately, eczema also can present in the same way. So there you will need an expert help. But something which comes in the private areas, if you want to do something initially before you come to the doctor, you can use a plain antifungal cream, as I said, without any steroid. So even the chemist gives it, you can Google it. Nowadays, Google has made it easier for you. So it should be a plain antifungal, something like a Candid cream, without Candid B. Okay, so plain Candid or a keto cream, you can try if it comes in the private areas. But anything which does not respond after a week, you should meet a doctor. Do not delay it a lot.
Right. And as a doctor, how do you diagnose? I mean, are there tests, or just by clinical investigations, you can say that, yes, this is fungal infection, or how deep it has gone?
So most of these common fungal infections, most often it is easy to diagnose clinically. As I said, these symptoms will be there, and we know the pattern of that rash, and the site of the rash, the itching, all helps us to diagnose it. But sometimes when they have used some creams, or it doesn't come in the classical way, we also have a doubt. So we do something called as a KOH smear. So we can just take the scales or that scrapings from the rash and we examine it under microscope, and we can see the fungal elements, which confirms the diagnosis. So blood test is not routinely necessary unless it is a deeper fungal infection and all that. For associated features, like if they have a diabetes and those kind of things, we do a blood test, but mostly it is by this KOH smear. Now, another way of diagnosis, sometimes when you have this vaginal yeast infections, we can do a culture. So they'll have discharge. So we take the sample and we can do a culture where it comes out confirmed. But only thing is culture takes some time. So unless it is absolutely necessary, most of the fungal infections are by clinical diagnosis.
Okay, doctor. And doctor, what treatment options are there to treat a fungal infection?
So we have a variety of treatment options, starting from a topical regimen where you apply something on the rash, going onwards to a oral medication, which is the oral antifungal therapy. So topicals, we have different types of, it comes as creams, ointments, lotions, different formulations are there based on the area involved. So suppose it is a fold area where you naturally sweat, a lotion will be better than a sticky ointment. Similarly, if it is coming on the head, on the scalp, there also a lotion will be better. But if it comes on the nails or on the hands and feet where the skin is thicker, we use the certain thick ointments. Or if the patch itself is very dry, then also we can use an ointment, which will give it a little bit of moisture. So we have different medical compositions. We have this luliconazole, cetoconazole. So these are the different ointment or the topical formulations that we have to treat the fungal infection. So we use it if it is initial rash, if it is like 1 or 2 rashes, the first time it is coming. So then just using a ointment will help. But if it is a recurrent infection, if they are having it for a long term, they have tried something else, it's not working. If it is coming on thicker areas like the nails, so those areas we definitely start on oral medications. So we have this oral antifungal. The most commonly used is something called itraconazole. So we give it, we add the oral medication as well as the topical creams. And for most fungal infection treatment, local hygiene and how you take care of it is also very important apart from these tablets. Otherwise, you can get it again and again.
Okay. Now, as today our, we are focusing on antifungals, we would like to know, doctor, how do these antifungal medications work?
Yeah, so there are different mechanism of actions depending on the medicine we use. So most of them, what they do is they disrupt that fungus cell wall, cell membrane, certain protein synthesis inside the fungus. So all of these are disrupted. So that results in killing the fungus and it takes care of it. So we have 2 types. We classify it as fungicidal and fungistatic. So fungistatic means it suppresses that fungal activity, but it may not kill it completely. Whereas fungicidal ones are more stronger ones, which will both kill, like it will kill it at a more potent effect compared to the fungistatic ones. So they damage the fungus cell wall, they damage the fungus cell membrane, the protein synthesis or the DNA RNA combination of the fungus, and that's how they take care of the fungal activity.
Right. And doctor, how do we take these, antifungal medications? Any special way to do that?
So there are doses for depending on the tablet. So as I said, oral, it can be a single or a double dosage. It all depends on the patient weight and which medication we are giving it. And duration is very important for this antifungal treatment. So we judge this on the clinical improvement as well. So typically what we do is nowadays, as I said, it has become an epidemic. There is a lot of chronic fungal cases. So what we do is we have to look at how the particular rash, the fungal rash is healing. And once it is 100% healed, we sometimes continue it even for another 2 to 4 weeks. So the tablets we may continue for another 2 more weeks to establish, complete cure, complete clinical cure, as well as the ointments we may even continue for a month, even once the rash is healed. So that duration is important in order to ensure that the fungus that is completely cleared. Because most often what people do is, as soon as they feel some relief, they feel the rash is reducing a little bit, they stop the medication. And then within another 1 or 2 weeks, it comes back with much more flare.
I was about to talk about it because many a times we have seen, patients as soon as they get some relief, they'll stop following
Stop.
the prescription.
Yes.
Again, when they'll, see the symptoms, because they have the prescription, though even they won't even bother to go to the doctor. They'll just go to the chemist and buy those medicines and start it all over again, all by themselves. So you are saying it is not a good practice. Uh,
No, no, not at all for the fungal infection, because one of the reasons for treatment failure or long-term infection is this lack of compliance from the patients, where they stop it abruptly or they don't take it for the time duration that we prescribe for them.
Right. Reoccurrence is again very common. We have seen a lot of patients in our society who, get fungal infection again and again. What is the reason, doctor?
So the main reason is lack of proper treatment. So as I said, the fungal infection nowadays, we need a little long-term treatment. Earlier it was 2 to 4 weeks, they get cleared. But now with the steroid usage and, all those other things, it is the duration of treatment has increased. So at least we need about 4 to 6 weeks to clear the infection. So if you don't take it for that recommended duration, then of course the fungal infection keeps coming back. So the patients also will say, I went to a doctor, I took the medication for 2 weeks, it was better. Then again, the next month it came. So this is all because of lack of treatment for the proper duration. So that's one of the main reason for recurrences. Secondly, sometimes if the family members are having it, so some people take treatment, some people ignore it. So again, they keep getting it from the other family members. So it's more of a social disease rather than an individual disease. So everybody in the family or everybody in the hostel should take the treatment so that it doesn't keep spreading to others. That's the second thing for recurrence. Then sometimes some people, they have some inherent deficiencies. So their immune system is not very active in controlling the infection. So most commonly this iron deficiency, vitamin B12 deficiency, so or thyroid, some hormonal issues when they have thyroid, or if they are diabetic. So those people, their immunity is a little on the lower side. So on that note, they keep getting recurrent fungal infections, because some of the fungal infections is not from outside. This is a normal fungus that we, like yeast infection, it's normally present in our body. So when these immunity becomes low, or when they frequently take antibiotics, so that again reduces their immunity. So all these things can also make them get recurrent fungal infection.
Right. So two important things are A, to consult a qualified doctor in case you have fungal infection or say any infection, and B, please do not do self-medication. Don't follow the influencers. Don't go by what your friend or family is saying. Don't go for over the counter medication by asking the pharmacist or the chemist. Please go to the correct person, which is a qualified dermatologist. That's really important. Now, again, because as you have already said, doctor, that, fungal infections are quite common in private areas. And this is one topic we normally do not discuss, right? And that's why many a times the family won't even know that one of their member is infected by fungus, because nobody speaks about it, or there are very, very few people who actually speak about it unless and until the situation gets really bad. So, what would you like to say to all those who are listening and who may have had, fungal infection, especially in their private areas?
Correct. So the thing is, even if you feel a little, you don't want to discuss it with your friends or family members, if you feel there is a suspicious rash which looks like a fungal infection, please do reach out to the doctor at the earliest. You can go individually, you can start your treatment. Basically, you have to consult. So sometimes what happens is, if you share among the family members, at least they can give guidance that I also had the same issue and I have gone to this doctor and got it treated. So if you feel like speaking about it, do it. Otherwise, at least by yourself, you go to a doctor and start taking the treatment.
Right.
And
As we
another thing to avoid it is by not sharing any of your personal items.
Right, that's very important. And doctor, many times people will ask that, are there any potential side effects of these antifungals?
These are also just like antibiotics. So they are a potent medication. So you should never, oral antifungals, definitely don't take it, don't self-medicate it. Only a doctor prescribed medicines. I mean, only if the doctor prescribes oral antifungals, you should take it, because they can have some, if you take it for long duration, or if you have any other comorbid issue and you take this medication, you can have side effects which affects your liver, kidney, and all that. So for that matter, the doctor prescribes it only for a prescribed duration. And in special cases, even if we want to extend the duration of certain antifungals, we do certain blood tests to make sure that you're not having any side effects from the medication. So as you were saying earlier, this is one reason you should not repeat the prescription by yourself. So you should not just keep on taking it whenever you get the infection. Always discuss with the doctor. And if you're somebody who have been taking it for a long time, you should do certain blood tests to ensure that you're not having any issues, internal issues due to the tablets.
Is this again one of the reasons responsible for antifungal resistance? Again, antifungal resistance is a term that we get to hear a lot. What is that, doctor, and why it happens?
Yes. So antifungal resistance. So unlike antibiotics, you don't quickly develop resistance to antifungal. So that is one good thing. But more than resistance, what we are worried about is the side effects on long-term usage of it. But yes, in certain cases, if you keep taking it for a long duration, you can develop the fungus which are resistant to that particular medicine only will start growing. So that way, yes, resistance can also develop. So another reason why you should not take it without a doctor's prescription. Yes.
Right. Doctor,
and one more thing which I forgot to say is sometimes if you use a very strong antifungal for a very mild fungal infection, then also there is a problem that later on when you try to use it, it cannot be as effective. So that is why we prescribe the medications based on the severity of your disease. We go with mild antifungals sometimes potent antifungals. So that is also important so that you don't develop resistance later on, and the potent ones also don't work for you.
Right. And doctor, who shouldn't take these antifungal medications?
Sorry?
Who shouldn't take these antifungal medications?
Yeah. So pregnancy, of course, antifungals are contraindicated. You cannot take any oral antifungals. You can go with topical creams, but no oral medications during pregnancy. Then depending on the person's comorbid condition. So suppose he has an existing liver disease, we don't give a certain type of antifungal. We give something else. And if they have a renal problem or a heart problem, so then also we have a certain medicine which can be given, but not the others. So everything doesn't work for everybody. So in pregnancy, it's strictly contraindicated, and people with liver, kidney disease, we give those specific antifungals which they can take, but not all of them.
Right.
And first 2 years of life, like in newborns and infants, if they have any fungal infection, there again, certain set of antifungals are contraindicated, like itraconazole and all. We don't use in the first 2 years of life. We have something else like a fluconazole, which can be. So age, their other comorbid status, pregnancy, all these are the factors we have to consider when we give the oral antifungals.
Right. Anyways, in pregnancy, we don't know that we know that we just can't have anything, just can't pop up any medicine or antifungal medication,
especially the first 3 months.
Right. Plus, as a lactating mother, again, there are things that a person is not supposed to do.
Mother, again, the ones which we can give for the newborn, that medicine can be given, but not all the antifungals.
Many times, women or especially lactating mothers suffer from fungal infection around their breast. And is it okay if they can, still feed their child?
So it depends on how bad the infection is. So if it's mild type, then we give them ointments. We ask them to clean it properly before they feed the child. Especially if the child, if the baby is, very young, like less than 6 months and all that. But if it is a severe infection where, it gives a lot of pain to the mother, plus it affects the milk supply, we can try feeding on the other breast if that is okay. And otherwise we can, express the milk and then give it to the baby. because sucking also causes a lot of pain to the mother. So expressed breast milk can be tried. We can sometimes give a rest for a few days if possible,
Right.
if it is only on the one breast. So that can be taken care. And other times, yes, we apply the ointment and make sure they clean it properly and then feed the child.
Right. I'll quickly take some of the questions that our viewers have sent. So Kaira Chauhan is here. Her question is, how long should I continue using the antifungal treatment even if my symptoms have resolved? A very similar point that we were discussing.
Correct. So, first thing I would tell, that is for a doctor to assess, because sometimes you feel it is okay, but the doctor feels it's not okay.
Right.
So, firstly, do go back for proper reviews. But on another note, as I said, once the infection is properly contained, once the skin becomes normal, we may continue the orals for another 1 or 2 weeks extra. And sometimes the creams we continue even for 2 to 4 weeks extra.
Okay. We have Sonam Sarathe. Her question is, can I use over-the-counter antifungal creams or remedies in conjunction with the prescribed medication, or would that be a counterproductive or potentially harmful thing to do?
Sorry, I didn't, can I use it where?
Antifungal creams or remedies over the counter with your prescribed medicine. I mean, the prescribed medication from a doctor and antifungal creams or remedies over the counter.
So antifungal creams also will be prescribed by your doctor, right?
Right.
Yes.
So there's no need of going to the chemist all by yourself. Sonam,
Yes.
take the prescription.
So the only times is when it is an emergency, and typically fungal infections are not an emergency, but still, if you are not able to meet the doctor for a week or so, then you can just try antifungal creams, but plain antifungal creams without any steroid.
Right. Yashi Jan is here. Her question is psoriasis also a type of fungal infection?
No, psoriasis is a totally different skin condition. It's more of a genetic and an autoimmune condition where there is a lot of inflammation, and it's typically a chronic problem. So sometimes private areas, when you get psoriasis, it may mimic a fungal infection, but your doctor can always figure it out.
Okay. One last question.
And psoriasis is not contagious, unlike fungal infections.
Okay, fair enough. And one last question from Rohit John. Can fungal infection reoccur? How can I prevent them from coming back? Though we have already discussed it, doctor, but still just as a thing to.
So of course they can reoccur when you are exposed to the fungus again, or as I said, when some of the other family members get it, or when you don't do the treatment properly. So ways to reduce it is always take care of hygiene, make sure other members are also treated, make sure you treat the infection for the right duration. And if you have any other comorbid issue like diabetes or any vitamin deficiencies, make sure that is also addressed.
Right. And before we sum up the whole session, Dr. Renu Nair, any take-home message for our viewers?
The main take-home message I would like to give is, do not self-medicate yourself. When you suspect a fungal infection, do not take random creams from the chemist and start using, because you're going to spoil your own skin, as well as you're going to increase the duration of your treatment. So make sure you visit a doctor when you get the infection. And also fungal infection, we can reduce it by making sure that we are hygienic, we are taking proper care of our skin, and proper care when we go to public places and all that. So take care of yourself and take care of the treatment part at the initial stage itself.
Right. Thank you so very much, Dr. Renu Nair, for your valuable time. And it has been a very informative session for our viewers. And we really look forward for many more such sessions in coming times with you. Thank you.
Sure. Thank you so much.
And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day to all of you. Goodbye.
Thank you.